Hello. This short module will go over the foundations of point-of-care ultrasound and should be reviewed before or on day one of your ultrasound rotation. The goal of this module is not to make you an ultrasound expert, but rather understand the foundational framework behind how ultrasound images are created, optimized, and acquired. Going through the learning objectives for this module, by the end of it, you should be able to explain basic ultrasound physics, understand the big five, that being depth, gain, frequency, indicator, and focus, and apply these concepts to optimize imaging. Select the correct probe based on indication, and use foundational probe movements intentionally. Ultrasound is a form of imaging that uses sound waves at frequencies above the range of human hearing. When an electrical current is applied to the ultrasound probe, it causes small crystals in the probe head, called piezoelectric crystals, to vibrate. When a probe is placed on the skin with an appropriate transmission medium, these waves travel into the body, penetrate deeper tissues, and are reflected toward the probe as echoes. The returning echoes are converted back into electrical signals, which the ultrasound machine processes into a grayscale image. Brighter structures represent stronger echoes reflected, and darker areas represent weaker or absent echoes. How dark or bright a structure appears on ultrasound depends on how much it transmits or reflects ultrasound waves. This is a property known as echogenicity. Fluid transmits ultrasound waves very well and therefore appears dark or anechoic. A classic example of this is blood within the chambers of the heart. Calcified tissue, such as bones or calcium-based stones, reflects nearly all ultrasound waves. As a result, it appears very bright or hyperechoic and prevents the visualization of structures beneath it. Most soft tissues, such as myocardium or skeletal muscle, partially transmit and partially reflect ultrasound waves, and therefore will appear gray on ultrasound. On ultrasound, depth does not represent the physical distance directly. It actually represents time delay. When the probe emits a sound wave, the machine measures how long it takes for that wave to travel into the body and return as an echo. Structures that return echoes quickly are closer to the probe and appear near the top of the screen, while structures whose echoes take longer to return are farther from the probe and appear lower in the screen. Increasing the depth allows the machine to listen for echoes for a longer period of time, which lets you see deeper structures, but at the cost of screen resolution. In clinical practice, your depth should be set so that your structure of interest fills most of the screen, as seen in the cardiac image here, without any unnecessary tissue below it. Ultrasound frequency determines a trade-off between resolution and penetration. Higher frequency sound waves provide better image detail, but are absorbed more quickly, thus limiting how deep they can penetrate. Lower frequency sound waves, on the other hand, will penetrate deeper, but with reduced image resolution. Each probe that we use has a varying degree of frequency ranges that it operates in, as shown in the image. Linear probes emit high frequency sound waves and are used for superficial structures, while phased array and curvilinear probes are lower frequency probes and are used for deeper imaging. Phased array probes have a small footprint that fits between ribs and are optimized for cardiac imaging, while curvilinear probes have a larger footprint and a wide field of view that is optimized for visualizing abdominal organs. Now let's talk about gain and focus. Gain controls the overall brightness of the ultrasound image. Turning gain up amplifies returning echoes and makes the image brighter. Turning it down attenuates returning echoes and makes the image darker. Gain does not change depth or resolution. Our goal is to set gain to maximize contrast and detail in the structure of interest without washing out or over-darkening the image. Focus, on the other hand, determines where the ultrasound beam is narrowest and where the image detail is highest. To optimize focus, the focal zone should be placed at or just below the structure you want to visualize. Because we're imaging three-dimensional organs on a two-dimensional screen, proper orientation is essential to accurately identify anatomy. The following will apply to every ultrasound exam you do. The orientation marker on the screen will always correspond to the direction of the probe indicator on the patient. we look at this kidney image, and I tell you to identify the superior and inferior poles, it's impossible to answer that question without knowing how the probe was held or where the orientation marker was relative to the patient. Now, when we see how the probe was positioned on the patient with the indicator pointed toward the head, the orientation marker on the upper left of the screen represents the cephalad direction, and the opposite side of the image represents the caudad. Therefore, on the left side of the screen, you will have the superior pole, and on the right, you will have the inferior pole. By standard convention, the physical probe indicator should be oriented toward the patient's right in transverse views and toward the patient's head in longitudinal views. As a result, in transverse imaging, the left side of the screen should correspond to the patient's right side, and the right side of the screen should correspond to the patient's left side. In longitudinal imaging, the left side of the screen represents the cephalad direction, while the right side of the screen represents the caudad direction. Cardiac imaging is an important exception to the standard indicator conventions, as the on-screen indicator will be on the right side of the screen. In parasternal long view, as shown here, the probe indicator is directed toward the patient's right shoulder. As a result, the indicator on screen that appears on the right side will correspond to the patient's anatomic right. It is important to recognize that this is view specific. In other cardiac views, such as the apical forechamber, the probe indicator may be directed toward the patient's left side, which will flip the image orientation. In this sequence, we will walk through the image optimization of a longitudinal view of a kidney in a stepwise process. For the purpose of this example, assume that standard indicator conventions are being followed. In the first image, a phased array probe has been inappropriately used. The depth is set too deep. The image is overgained. In the second image, the appropriate curvilinear probe has been selected. However, the depth remains too deep and the image is still overgained. In the third image, the probe choice and depth are now appropriate, but the gain remains too high, resulting in a washed out image with poor tissue differentiation. In the final image, we have the correct probe, appropriate depth, and optimal gain all set. This produces a clear and diagnostic image. This sequence demonstrates the importance of optimizing one parameter at a time, starting with probe selection and depth, and finishing with gain. Now we will talk about transducer manipulation. First, we'll start with the movement of sliding. This is where the probe is translated across the skin without changing angle. Sliding is used to locate the structure of interest and keep it centered as you scan. Make sure to keep the probe perpendicular to the skin surface. Next movement you will see is what we call fanning. This movement pivots the ultrasound beam about the short axis of the probe, allowing you to sweep through anatomy without moving laterally. The next movement is called rotation, or rotating. This changes the imaging plane by twisting the probe along its long axis, allowing for seamless change between long and short axis views. The next movement you will see is called rocking. This is a back and forth motion about the long axis of the probe. Rocking allows you to center your target of interest and improve its overall visualization. Lastly, compression increases pressure on the probe to improve tissue contact, displace air, and aid in identification of compressible versus non-compressible structures, and brings deeper structures in closer for better imaging. Thank you for reviewing this module. We hope you've gained a solid foundation in essential ultrasound concepts. Happy scanning.